Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them like a walkover. Today, we're discussing common non-enveloped DNA viruses. Try these cues before we start. Which virus is associated with the slapped cheek rash in children? Which non-enveloped virus can cause strep throat-like illness? Which bug gives rise to the common wart? Hang tight. Adenovirus, human papillomavirus, and Parvovirus B19 are common non-enveloped DNA viruses. Adenovirus and HPV both carry double-stranded DNA in an icosahedral shell. Parvovirus B19 is the smallest, packing single-stranded DNA into the same geometric design. Adenovirus uses its fiber proteins to attach to host cells. Early proteins, or proteins made early during infection, like E1A and E3, help it dodge immune defenses and prevent apoptosis. Adeno spreads through respiratory droplets, feces, contaminated hands, and swimming pools. At-risk groups include children, military recruits, and the immunocompromised. After an incubation of 2 to 14 days, adeno usually causes a short illness, though some types can persist. Adeno can cause strep, like pharyngitis, conjunctivitis, often called pink eye, viral pneumonia, and gastroenteritis. In the immunocompromised, the disease can escalate to severe pneumonia or disseminated infection. Adeno has no strong link to cancer. Doctors usually spot adeno by symptoms alone, but a polymerase chain reaction test on a swab confirms infection when the disease is severe or occurs in outbreaks. Treatment is usually supportive, though cidofovir may be considered in severe cases. Prevention relies on good hand hygiene, proper chlorination of swimming pools, and a live oral vaccine available for military recruits. Next is HPV. High-risk HPVs use E6 and E7 proteins to inactivate the tumor suppressor proteins, RB, and P53, allowing infected cells to survive and potentially become cancerous. Low-risk HPVs stimulate localized cell growth, producing warts with minimal cancer risk. Transmission occurs through skin-to-skin contact, sexual contact, or vertical spread at birth. Those most at risk are young children, the immunocompromised, sexually active people, and anyone unvaccinated. HPV can incubate for weeks to months and persist for years, causing hand and foot warts, genital warts, and cervical cell abnormalities. While visible warts are usually benign, not all HPV strains make bumps. High-risk types, especially HPV 16 and 18, can stay hidden or co-infect warts, driving precancerous changes that can become cancers of the skin, cervix, anus, penis, and throat. Doctors recognize warts by sight. For genital or cervical disease, Pap smears and HPV DNA tests can detect high-risk strains. PCR is sometimes used. Treatment focuses on lesion control, such as with topical agents, cryotherapy, or surgical removal, but these don't eradicate the virus. Avoiding direct skin-to-skin contact with existing warts helps reduce HPV spread. Protective measures like covering lesions or using footwear in communal areas are effective. Safe sex practices help. Vaccination also protects against HPV infection. Next is Parvovirus B19. Parvo spreads via droplet inhalation, blood transfusion, or mother-to-child transmission. It specifically targets red blood cell precursors by binding the P antigen. Children are the most common group affected, though pregnant women, people with hemolytic disorders, and the immunocompromised are also at risk. After about 2 weeks of incubation, patients usually develop acute fever and then lifelong immunity. Parvo causes fifth disease in children, presenting as a slapped cheek rash. Adults often have joint pains. Infection may trigger an aplastic crisis in those with underlying blood disorders. Infection during pregnancy can cause hydrops fetalis or stillbirth. Immunocompromised hosts may develop chronic anemia. Despite these complications, Parvo isn't linked to cancer. Diagnosis is usually by serology. PCR can detect viral DNA in severe or unclear cases. Treatment is supportive. Severe anemia may require transfusions. Intravenous immunoglobulin is used in persistent cases. Parvo has no vaccine. Prevention focuses on blood screening and minimizing exposure in pregnancy. Let's review. Which virus is associated with the slapped cheek rash in children? Answer: Parvovirus B19. Which non-enveloped virus can cause strep throat-like illness? Answer: Adenovirus. Which bug gives rise to the common wart? Answer: HPV. Nailed everything? Golden. If this video helped you, like, share, and subscribe. Go over the comparison table from the link in the description. Thanks for watching.